My amendment takes the $40 million allocated in this bill for abstinence-only education and redirects it to the Minority HIV/AIDS Fund, which supports science-backed treatment and prevention programs in communities with disproportionately high infection rates. As recently as 2019, Black and Latino communities accounted for 70% of the new HIV diagnoses, despite making up only 32% of the population. This is not a new phenomenon. The Minority HIV/AIDS Fund was established as part of the Minority AIDS Initiative in 1998 to deliver critical prevention and treatment options directly to the most impacted communities. The fund supports projects across the country in Black communities, rural communities, immigrant communities, etc. It prioritizes folks that are affected by substance abuse and mental health challenges and is a crucial part of our federal response to care, prevention, and treatment. So rather than cutting $35 million in funding from this initiative, my amendment increases it by $5 million without adding a penny to the bill's top line figure. Abstinence-only education is not education at all. It's the opposite. It is a strategy based on withholding information. It doesn't work, and it deprives young people of access to crucial medical information. I encourage my colleagues to support this amendment and the Minority HIV/AIDS Fund, which has provided evidence-backed prevention, care, and treatment to people suffering from this disease for nearly 30 years. I thank you, and I yield back.
I rise in support of this amendment. Abstinence-only education has been a failure everywhere it has been tried because it denies people necessary and even life-saving information about their own bodies and reproductive health. Research in the American Journal of Public Health has shown that not only does federal abstinence-only funding fail to lower teen birth rates, the more that state policies emphasize abstinence-only programs, the higher the incidence of teen pregnancies and birth. A separate analysis funded by HHS also found that abstinence-only programs do not affect the incidence of pregnancy, HIV, or other STIs among adolescents. By contrast, the Minority HIV/AIDS Initiative has been extremely effective at improving access to care and reducing disparities in health outcomes among populations that have been hit the hardest by HIV/AIDS. From providing core medical and support services, to conducting outreach and education, to providing culturally and linguistically targeted care, these funds are crucial to life, to saving lives and improving the quality of life for those living with HIV/AIDS. There are 1.2 million people with HIV in the United States, and more than 30,000 people are newly diagnosed with HIV each year. They deserve funding and support through proven programs. I urge my colleagues to support this amendment, and I yield back.
Thank you, Mr. Chairman. I associate myself with every word that my ranking member has just spoken on behalf of this amendment, and I urge the support from my colleagues. Thank you. And thank you, ranking member.
Thank the gentlelady. On this vote, the ayes are 27, the noes are 31. The amendment is not adopted.